Got it.
Good afternoon, everyone, and welcome to this amazing live session with Looms for Lupus. And we have, I am one of the co-founders of Looms for Lupus. My name is Estela Mata, and joining me is my sister. Oh, you're on mute, sister.
Sorry, everyone. Good afternoon, everyone. My name is Juana Mata, and we're excited to be here. I am also co-founder of Looms for Lupus. We are the Mata sisters. Welcome, everyone.
Yes, and we are so excited that you're all joining us. So please, as everyone logs in, please let us know who you are and where you're tuning from in the live comments. And also know that today's session, it's going to be interactive. So we want to hear from you. We want you to learn about all the amazing things we have our special guests talking about. This is not just for the lupus community, not just for the fibromyalgia community, but for everyone in the community. So please share right now. If you're tuning in, share on your sites as well. And we have a special guest today. We have Liz Helms, President and CEO of the California Chronic Care Coalition and Director of Chronic Care Policy Alliance. Liz Helms is the president of these amazing organizations and an alliance of a nonprofit social, consumer, and provider organizations that are united to improve the health of Californians with chronic conditions or diseases. In 2017, Liz co-founded the Chronic Care Policy Alliance, working across state lines to ensure access to affordable, quality health care, giving states a broader voice and advocates for the enforcement of anti-discrimination laws in the ACA. She serves on many advisory councils, including the CDC's National Hypertension Control Group. And here today, we have Liz Helms to talk to us about her journey as a patient and now directing these amazing organizations all for you.
Wow. Estela, thank you so much. I'm very honored to be here today, and I'm especially doubly honored to be with two of my favorite sisters, the Mata sisters. We've been working together for some time. Since we met, we've never stopped talking to each other. And so I'm in awe of the work that you guys are doing, and I'm just delighted to be here today. So thank you for having me. I do want to bring a big thank you to the team. There's a big team behind all of this today. We are live streaming. Now I have to tell you, this is the first time we've done the webinars, we've done the broadcast, we've done podcasts. We have never done Facebook live streaming. And we didn't just do it in one place. We have 3 different organizations live streaming right now. So we have Megan Yee working on My Patient Rights. We have Juliet Barramond working on the California Chronic Care Coalition Facebook, and then the Mata Sisters with Melissa Tallware that is working on the backside, that's kind of running this whole machine today. So we want to make this really interactive. I have a lot to cover in a fairly short amount of time, and so I'm going to go ahead and get started. So if you want to bring up the PowerPoint, and then we'll move it to the health literacy slide. Perfect. Okay, so thank you. So I had several things to discuss with you today. And so one of them is about health literacy. I know that things can be really difficult. And one of the things we try really hard to do in the coalition is ensure that what we're putting out is easy to understand. And that doesn't always happen. So I just wanted to go over a little bit of the working definition of what health literacy is, and then I have a question for you. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So if you don't understand what someone is telling you, what you're reading, how can you be the best advocate that you possibly can be? So it's very important that you understand the background information, what your rights are, how to better advocate for yourself. So I have a question for all of you. This is question number 1. I'm making it really simple. On a scale of 1 to 10, and you can put it are they putting it in the comment box? On a scale of 1 to 10, how would you rate your understanding of the healthcare system? So I'll give you just a few seconds to go ahead and just put a number in there. And then we can move on to the next slide. Are we getting any answers?
Yes, we are. So we have a couple of answers coming. I'm even answering myself. And I might have given my score a little high. I did an 8, but only because I'm always trying to read and learn. But you never stop learning. But some people are responding 3s, 7s. There's a few 7s there.
Oh, I see them coming in now. Yeah, that's very cool.
4s, more 7s.
Great. So that's very helpful for me to understand where you are. And I know we still need a lot of work. A lot of work needs to be done. For all of you that put in 7s, that's really great. Now we just need to get you to 10. So you, when you look at things, you say, oh, yeah, I get that. I understand that. Some of the information I wanted to share with you today, our legislative session in California has started. And as we get started this year, last year, and first of all, I want to let you know that if you've had problems with COVID or anyone and you've lost your family, our hearts go out to you. We are really trying to get through this all, and hopefully we'll see the light here pretty soon. So COVID had a major impact on our legislative process last year. And the bills that rolled out at first, because we didn't think things were going to shut down the way that they did. So we go through over 2,000 bills a session. We look at them and then we pull out the health bills that we think are going to be really important to people that have chronic conditions. And last year we had probably over 70 bills on our list that we were looking at to support or oppose. Bills that we would be very active on, some that we wouldn't be as active on, but could still support. And then all of a sudden they started cutting and cutting and cutting and cutting. And when that happened, we went down to almost nothing in being able to get legislation done. So this year, as they've rolled out the new session, we are back up to looking at over 2,000. I think the last count was like 2,300 bills. The deadline was last Friday, so I haven't seen the final number that's rolled out, but we will know that probably by today or tomorrow. And we were very lucky this year that we have a bill that we're going to be sponsoring. And there's 3 bills I picked out to kind of go over with you that are up and running right now within our coalition members. And the first one is our sponsored bill, which is AB 752. And this is a Nazarian. And this is the Patient Choice and Transparency Act. I'm going to do a little overview on it. Kind of show you how we do things, why it's important to advocate, and how we can see to best engage you guys to get more involved in the work that you're doing. So this bill, what we're so excited about this bill is we already have multiple co-authors, 2 from the Assembly and another one from the Senate, which is very helpful. And we may have more co-authors as that comes on. So that means they're already talking to people. They want to see this success. They're going to support these bills, and it has a better chance of getting through. Our first hearing will be in the Health Committee, and I don't have a date on that yet. They don't have the dates up yet. And right now I'm hearing that maybe we actually will be going into the Capitol to testify, where last session everything was done virtually. So all of that, it can change. It's a work in progress, and we'll just have to wait and see. But let me tell you a little bit about this bill and then how we put, when we're working on legislation and public policy, how do we tie this all together? What's our activities? It isn't we just get a member and we have a bill and we say, okay, here it is, and we're just going to go in and support it. There's a lot that goes on behind the scenes. To get the bill up and running, we have already talked to every member on the Senate and the Assembly side in their health committees to let them know this bill is coming. And that was quite interesting because those were all virtual calls. And then when we found out that we had an author, we went to work and we put out a press release. Assemblymember Nazarian put out a press release. We're coordinated with their communications division, with their staff, with our staff. We actually do have lobbyists that are working under our contract with the Chronic Care Coalition. Under the state law, we have to be either escorted or we have to be lobbyists. So we stay on the advocate side, and then we hire contract lobbyists to work with us on the work we're doing. So we do the fact sheets, the press releases, and then recently we've got the letters of support that we need to get from everyone. So this is all being circulated. We're going to be doing phone calls to get letters of support. Let me tell you a little bit about the bill. We learned that there had been a tool that came, we became aware of this tool. It's called the Real-Time Benefit Tool. And it came out of McKesson. And McKesson and Cover My Meds. And this last year, I had the great honor to be on the advisory committee of the medication access report that was launched last month. Working with McKesson, who is one of the biggest suppliers of medications and a big supplier of what's happening with COVID right now and getting the medications out, it's been very interesting because what they have in technology surpasses anything that I've seen before. So what happens, the situation right now is someone goes to the doctor, they get a prescription. The doctor gives them the prescription, and they go to the pharmacy to get it filled, whether they go to mail order or whatever. Many times they find out once they get to that pharmacy counter that the out-of-pocket cost is unaffordable, or there's utilization management, which includes step therapy and prior authorizations and different things that happen. They find it out at the pharmacy counter, not in the doctor's office. So what we're doing now is we are going to take that technology and move it upstream into the doctor's office. So when you're seeing your doctor, and whether it's a telehealth appointment, whatever the appointment is, when you are with your doctor or the provider of that team that's going to write your prescription, they will be able to see with this technology if that medicine is on your formulary, what it's going to cost, are there prior authorizations or step therapy, and I'll get into the step therapy in the next bill that we're going to talk about. You'll be able to know when you leave the doctor's office if you're going to be able to, one, afford the medicine, what the medicine is, and a better idea of what you're going to be doing with that medicine. So we're really excited. This is a big change maker for consumers, a real positive consumer piece of legislation, and we hope we can get your support on that. And I'm going to move on to the next bill because we have three of them, and we have just a ton of information to go through here.
Liz, really quick, before you move on to the next bill, can you just tell us why this is so important? Why is a bill so important to us, the patients or caregivers or loved ones? Why is it important for you to be creating or supporting these bills?
Sure, thank you. So we're very patient-centric. The California Chronic Care Coalition believes that people should have access to quality, affordable health care. Timely, affordable health care, that's quality. The patients are many times left out of the equation. So we bring that voice to the equation. We're there representing the voice of the consumer. And when we sit down and have discussions, especially if we can bring a patient forward with the patient's story, that makes a huge difference because every voice matters. Every single person's voice matters. And so within the coalition, we represent now over 16 million people in the state with chronic conditions. And so we have a pretty good voice to make sure that they haven't forgotten us. You know, that we're in the center of this whole discussion, and they make decisions about us without us. So we say, okay, we're here. You're going to make decisions now with us because it is about us. Does that answer your question?
Yes, that's perfect. Thank you.
Sure. And stop me anytime to ask questions. Okay, so the next bill that you're looking at, this is the step therapy bill. This is Dr. Arambula, AB 347, and it has 3 co-sponsors and lots of different co-authors. So the co-sponsors are like the Chronic Care Coalition or the organizations that brought the bill forward, and then the co-authors are multiple legislators that are getting on board to support it. So the step therapy bill is sponsored by the Arthritis Foundation, Crohn's and Colitis, and the California Rheumatology License. So they have the physicians and 2 patient groups, and then tons of supporters from different organizations. This was one of the bills that got cut last year. It went pretty far, and then all of a sudden it was gone. And so it has come back this year, and we're really happy that Dr. Arambula has picked it up and is going to be able to move this bill through. The importance of this bill ensures that people that are making utilization management decisions, again, that's your step therapy. Now, step therapy is you have to fail first on a drug. So when a formulary is put together, there's things called tiers. So your drugs may be on certain tiers. Well, maybe they want you to be, maybe they're going to say, okay, there's a generic that's an equivalent to a brand name drug. We want you to take that first. We want to see what you're going to do with that first. And then generally, not always, but generally the first drug on a step therapy protocol is the least expensive. So you may start there, even if the doctor doesn't believe that's the absolute right medicine for you to take out the door. Don't ask me how this whole thing got started. It's crazy. So what we've asked now is when someone is looking at a prior authorization or a step therapy protocol, that they should be a peer. There shouldn't just be anybody looking at it that doesn't know the patient or doesn't have the background of what that person is going through. So if someone has arthritis or someone needs, an injectable medicine, which is a biologic or a biosimilar, which are some of the very new medicines, but they are definitely more expensive. So we want people that are going to be making those decisions to understand that disease state. So it works in that here. And then it requires the protocols to be reported to the Department of Managed Healthcare and the Department of Insurance. And why is that important? I'll get into that when we get into the My Patient Rights. But what's really important about that is that you have an opportunity to get an independent medical review. If you've been denied a medicine, you have the opportunity to get an independent medical review. So I will get more into that in just a few minutes. What we want to do is really engage you in this issue. And I would love for everyone, this is out of my question, but I'm thinking of a new question. So I'm going to add a question in here. How many of you have had a denial to accessing your medicine or have had a protocol put in that was a barrier to get the care that you needed? That's a yes or a no. Do we have any answers?
I don't see any answers yet, but if anyone has had, whether it's a denial of a specific treatment that you know was for you, or that you were expecting to get and were denied, or said, you know, we can't give you this medication, we need to give you this other one first, please let us know. You don't have to be specific, or if you want to not put your comment live, you can send us a private message as well. This is going to be good information for everyone, because we really should not be denied treatment, right? That's one of our patients' rights, which I'm sure Liz is going to discuss later. But you could just click, type in the message yes or no if you have. That would be helpful.
And we can move on to the next slide.
Yes.
Okay, this is the last of the 3 bills that I wanted to talk to you about. So this is also a bill that's come back this year from last year. This is authored by Assemblymember Daley, and this is sponsored by the California Access Coalition. This is a very important bill, and why is it? It has to do with rebates. Now, want to talk about health literacy? Rebates can be incredibly confusing. So, as we think so many times that the prices of medicines are all the fault of the pharmaceutical industry, that is not necessarily true. There are lots of ways or lots of tiers that product has to go through until it gets to the pharmacy. One of them is through a pharmacy benefit manager, which we call PBMs. And PBMs are the ones that negotiate the prices. Well, what the PBMs have done, and we have worked on another bill that was passed a couple of years ago, they did have a gag order on pharmacists. So if you went to the pharmacy counter and you asked, you know, what's the price of the drug, or is there a less expensive medicine, or is that medicine less expensive if you just pay cash for it than it would be if you even had a copay on it? Pharmacists weren't allowed to give you that information because they had gag orders in their contracts, and sometimes they didn't even know they had them because big organizations would be signing these contracts and it would be buried somewhere. So we were successful at taking that away. So pharmacists can freely speak to you now about if a medicine is cheaper, and that's a really good thing. What has also happened is something called the clawback. So during that period of time, if the medicine was cheaper and you didn't get it, there was a clawback that the PBMs took back, which was the difference between what you were paying and what your health plan was going to pay. So now this got bigger, and the PBMs got a lot more power, and you see them merging with big organizations. So you see like the Aetna and the CVS merger and other mergers. And so now you're looking at the negotiated price of what that medicine is. That is totally different from what you pay. So if there's a clawback, there's a difference between what the pharmaceutical company is giving back to the PBM and what we get at the pharmacy counter. It could be substantial. This bill actually sets in play the opportunity for those rebates to be passed on through to the consumer where they should be. So the savings go to the consumer. Finally, really important bill. This is a huge consumer protection bill that will really help people with their out-of-pocket costs. Should I stop there, Estella? Do you have any questions?
No, I think the detail in all of these that you've been giving us is very, very great. It's very informative, because not everyone understands what these bills mean and how it's going to impact our care. So to know that these bills that you guys are working on are going to be utilized and impact me and makes me happy if these go through, because then I will be able to get the treatments that I need. I don't have to go and try a treatment that's going to fail, or try a treatment that is cheaper, mainly because, that's what's best for the insurance and not me, the patient. So all of these are great bills. And I think that the more we are aware of all these, policies and bills that are going to be impacting us, the more aware we are, and the more we share our voices, if any of these issues have impacted us negatively in our care, for us to be that voice and help these bills pass.
Thank you. That was great. So I'm going to move into my patient rights, but I want to thank you again, Estella and Juana, because you get it. You understand how important it is to have a voice. I know a lot of people, and especially when I started, because I started in advocacy back in the early 90s out of an insurance denial for me for care. And I was so angry at that time that I said, I've got to do something. I didn't know what to do. I didn't know how to do it. And I didn't even know what the word advocate meant. And I had some business associates that actually worked in policy, and they got me started. And as an angry advocate, I had to take that anger and rechannel it and put it in a positive way to actually make change. And what I had coming from the grassroots, when I'm talking to so many of you right now that are from the grassroots, that bring you here to this wonderful Facebook Live meeting today, is because your family member, someone you know, has had something happen to them. They have a chronic condition or a disease, or they've had issues, or they don't understand things, or they don't know what their rights are. And we went to work in the early 90s. It wasn't the California Chronic Care Coalition. And I have Joan Werblin sitting in the backstage that we're going to bring forward here pretty quick here when we're doing my patient rights. So she's been a huge champion. We've been working with each other for over 3 decades, which is a very long time because we were pretty young when we got started. But we're still here, we're still doing the work, and we need to engage a lot more people to come in and really work with us and help even take over for us at some point. So when I got started, what I had was my story. My story was me. No one could take it away from me. And the more involved I got in working on legislation, because there was no Department of Managed Healthcare. There was no TMJ Society, which was what my problem was. There was no place for people to go. The regulators were sitting in business, transportation, and housing. So it was under the business umbrella, and then there was the Department of Insurance. And then we still have, other agencies that look at healthcare. But when the HMOs were starting to come into practice in a bigger way than they had before, and the denials were coming in, we worked hard at actually passing legislation to develop the Department of Managed Healthcare. And then we worked on the Office of the Patient Advocate. And then we worked on 12 bills. By the late part of the 90s, we had 12 bills passed into law. Gag orders off of doctors, continuity of care, all kinds of patient protections, and disclosure. So when we first started, disclosure was not available. You didn't know what your health plan even covered until you joined, until you were a member and you got an evidence of coverage. And the evidence of coverage was, yay big. It wasn't. So by the time we got disclosure done, that they had to let you know what your plan covered prior to you making a decision. I mean, how can you make an informed choice? How can your employer make an informed choice if they don't even know what it is they're purchasing? And how do you know if you change plans, if your coverage is going to go from plan to plan? So we worked really hard on that, and we brought that forward, and we're still, we get newer legislators that don't have some of the backgrounds. We constantly need to educate them, constantly need to educate their staff. But let me go to the next slide and start on my patient rights, because I want to open this up for some questions too. And I'd love to bring Joan in. Can we bring Joan in? There she is.
I'm here.
So Joan, how this came about with the Right Care Initiative, not the Right Care Initiative, that was the that was the first one, knowing your rights. My patient rights came about because when we started with the Department of Managed Healthcare, they were given substantial amounts of funds to go out to the public and let them know that they existed. And as things started to tighten up, we went into a real, in that period in the mid, 2005 to 2010, when the bubbles were bursting and everything, the money dried up. So people didn't know there was a Department of Managed Healthcare. And so we decided that we needed to help them. And Joan, do you want to add anything to that?
It was something that no one had ever seen before. There was nothing like it. It was the first time that two lowly patients stood up and said, we have rights. And we have been doing that ever since. It was the two of us out there against the world, we felt. But it did open the doors and open the minds and thoughts of people on both sides of the aisle, as well as the medical profession, who didn't understand that we as patients had rights. And there was no oversight for insurance. So as Liz said, when you bought your insurance policy, not only did you not know what was in it, but it was never owned by you. It was owned by the insurance company, who could do with it as they wanted, even after you had signed on. So the first issue, and I know Liz is going to go into this, was switching medications. You were on a medicine, you bought an insurance policy, and then found out that they had removed that from their formulary and you could no longer get it. So there, those were the basic roots where we started. And this is why we want to continue with this and move forward. I'll turn it back to you, Liz.
Thanks. So what we decided to do to help support the Department of Managed Healthcare was we came up with My Patient Rights. So California-based My Patient Rights. And we started to get the word out, and we went and did community events and really tried to get the word out that there was a place for people to go if they were denied their access to care. And what you're looking at right now on the screen is when you go to My Patient Rights website, there is an explainer video that explains how to maneuver going through filing a complaint, and we've kept that very simple, very, very simple. We can go to the next slide. So we designed the mypatientrights.org to be a one-stop shop for patients to file complaints with their health plan and state regulators to access the health care that they need. So My Patient Rights has helped people who experience denials to procedures, barriers to medicine, medical bills from out-of-network providers, delays in receiving tests for chronic diseases, denials to specialists, billing issues. I mean, there's just a host of different issues. And probably you don't know that you had those rights. That one of the pieces of legislation we did work on was an independent medical review, that you can go outside of the health plan and get a second opinion. And we'll talk a little bit more about that in just a second. So let's go to the next slide and just ask So how well do you know your healthcare rights? Do you know that there are rights for you there? And that's on a scale of 1 to 10, where do you fall in that? And please put that in your chat box or your comment box. Do we have anything coming in?
Let's see, 5s, 8s. We'll see as they come up. But I think it's so important for people to know that if you go see a doctor, you are a patient, right? So you're a consumer, you're a patient. And the rights that we're talking about are the rights of the consumer, your rights. And so I know that we're using a lot of maybe words that you're not familiar with, but I know here on the My Patients' Rights page, they also have a very, very detailed description of what all these terms are. So I see a couple of 6s. I also see someone put a question mark, and it might be because they don't even know that they had rights. Who knows? It'd be great for us to find that out. But I see 6s, I see 5s, and 8s. So.
And I see Juliet has just put up the website to go to for My Patient Rights, mypatientrights.org. Know your /know-your-rights. They are very important for you to understand as you maneuver through a healthcare system. Now, maybe you've never had a denial, or maybe you just thought, what can I do about it? You know, they said, no, I'm not going to fight them. The other things I've heard from people is that they're afraid. I mean, they don't trust the system, for one, and they're afraid to speak up. And they think that if they do speak up, their health plan's going to get mad at them. It does not happen. It doesn't happen. And I said, if anybody felt that there was any retribution against someone, they just have to call us. Though the Department of Healthcare is there for us. They are our regulatory authority. They want to know what's going on, and that includes if you have Medi-Cal, any type of insurance, you can come through the portal. So let's go to the next slide. So there are several different areas that you can go to in the website to get information. And this one slide here help you understand what your treatment options are, what health plan barriers are. There's definitions, consumer-friendly definitions. What does out of network mean? What does adverse tiering mean? That's not a real simple word. And we also want your feedback. If you go to the site, you say, you know what, I don't really understand it. Can you clarify this? We'll make changes in the site, because the site is there for you, not for us. And we need to help you maneuver through the healthcare system the best we can. You go to the next slide. So I talked about California and filing a complaint. What we found out was that this was incredibly successful, and our regulators loved us to have something like this that would help people find them. So we went into more of a regional outreach into multiple states, and we started mostly in the western states. I think we started out with 17 states, and they kind of, some of them were on the East Coast, but primarily they were in the West. And that went off so well, and we started hearing from people, and we started doing roundtables in different states. We are now in all 50 states. And so all you'd have to do, no matter what state you live in, if you're, let's say you're in Arizona, you click on Arizona, it'll pull up who your regulators are. It'll give you the links to who your regulators are and how to file a complaint in your state. California, everything is there. What the health plans are, We always say go back to your health plan first. Go back to member services, file a complaint, try to get it remedied before you move out. But if you need something quickly, if you need care quickly, the HMO helpline at the Department of Managed Healthcare will help you, and they will help you quickly. It shouldn't take a long time. Or you could reach out to us and we can help you. So now that we're in all 50 states, we're hearing from people all over the country and issues that they've had. So let's go to the next slide. I already asked this question. I got ahead of myself. Have you ever been denied health care? Let me ask you this question instead. Did you know that there was a Department of Managed Health Care, which might be to the question that we had from the person that put the question mark in? And that would be a yes or a no. And Joan, while they're doing that, is there anything you want to add?
No, I think one of the things that oftentimes happens, you get a denial, but you're not aware of it. It comes back to the doctor. And all of a sudden, what he told you to do, he or she, your provider, told you to do, or the medicine you were told to take is now switched. And you say, well, why did you do that? It may be behind the scenes that your plan has denied it to the doctor. And so the doctor has to come up with another choice. And I would encourage you, if a situation like that happens, ask the question, why are we changing this? And find out, because it may just be your health plan is stepped in there, and you have a right to dispute that. You have a right to be included in that discussion. And that's a hidden right that you probably don't think about. It's just, oh, well, it was changed. I guess, they found something better. Be a good consumer. Think about when you go shopping at Walmart or someplace. If you get something that isn't what you paid for, what do? You take it back. So you need to be a smart consumer. And this is what My Patient Rights helps you to do. It gives you the words and the explanation so that you can just be a good consumer. I can't say it enough times.
Yes, and we do have some answers that are coming in. Some people are saying no, and some people are saying yes. And I think it's so important because sometimes we just think our insurance is our insurance, and we go with whatever the doctor says. And if the doctor says, yes, you're getting this medication, they may not even tell you they have to put in a request for an authorization. And so you just basically wait for your doctor to give you the instruction. And if it gets denied, your doctor may or may not tell you. So I think that, it's good that you guys are talking about all of this because not everyone knew about the managed care, program or that it was in existence. So we have some no's and we have some yeses.
Okay, great. That's great to know. So let's go to the next slide. So here's actually the page of filing a complaint, and you can see over on the right side, it lists all the different plans. Those links are all live. That'll take you to your health plan. And then if that doesn't work out, it'll take you the next step when you scroll down on the website to the Department of Managed Healthcare and how to access them and how to access some of the different agencies. So here's what happens when you have a voice and you stand up for your rights. Let's go to the next slide. So a couple of years ago, we decided, we've been working on this for some time. Independent medical review has been up and running. What's really happened to people that have gone through either the independent medical review or filed a complaint with the Department of Managed Healthcare? What happens to these people? Well, one thing that California, especially with the Department of Managed Healthcare, has done a really good job on is transparency. And you can go to the Department of Managed Healthcare website, and they have there's just you can get lost in there, but there's so much information. And so what we wanted to find out is what chronic diseases were being denied care. So we had a couple of interns, and they spent the summer working on looking at what actually happened to people when they went in. And we had we looked at 1,000 cases. Now this was looking at the case. Now the name of the health plan wasn't there, and the name of the person wasn't there, but the case was. So what we wanted to see is maybe what were the top 5 chronic conditions that were getting denied the most, or what were the results of having them overturned. So we were shocked with what we found out, because we found out the first one that came out was 67%, and that had to do with breast cancer, and they fixed that. So they were getting so many denials on this on different treatments for breast cancer. And so anyway, that one seems to have been fixed. 61% of the complaints that were filed from denials were overturned by the Department of Managed Healthcare, and people got the care they needed. This is huge. And if they didn't overturn, they gave the reason why. Or they might reverse it. So in the case, if it was partially overturned, that maybe there was a piece of it that they said, you can't say no to this, but you can say no to this piece. So we have quite an extensive list of cases, and we decided we needed to make this public. This is, like I said, this is so important. And on the front page of our Chronic Care Coalition website, you can actually download the full report. And I would welcome people to go there. So let's go to the next slide. Joan, do you have anything to add while we're moving forward?
No, just as you said, we were shocked. We knew it was going to be bad, but it was worse than what we thought.
And then we looked at the top 5 chronic conditions and diseases that had the most denials. And we were shocked again, because it was cancer, mental health, musculoskeletal, rheumatology, arthritis, those types of things, cardiovascular care, hepatitis. And the things that they denied them care for, some of them were just so ridiculous. How did they get away with that? And so we were thrilled. And then the big green box there was all the other ones that we put in there. It's like, don't give up. Don't ever give up. You have to learn how to advocate for yourself.
These numbers are such a great eye-opener for a lot of us. So these are the numbers of people that actually knew that they had rights and filed a complaint. Can you imagine the number of people that don't even know that they have rights, that don't even get the care that they need because they have been denied and not even told you've been denied? They could have just been told, we can't get this approved by your insurance at this time. And then the patient walks away thinking that that's okay. So it's amazing to see these numbers, and I'm visual, so I love to see all these colors and all these statistics, and to think of right now with the pandemic, we are all in this and are suffering so much. I live with fibromyalgia. I fall under the musculoskeletal, and I'm dealing with a lot of mental health issues. And I know in my family, we have cardiac issues and cancer. So what does that mean to me as a consumer? I need to know what my rights are to ensure that not just I, but my family gets the proper care that they need, because we fall under these categories. So this is so important. Again, this discussion, I think, is needed because our community sometimes doesn't know about these rights. So thank you for bringing up all of this information and these great statistics.
Thank you. And I know we're going to get short on time, and I want to open it up for other people, but let's go to the next slide and only stay there for a second. This lets you know, if you want to stay informed, you can send us your emails and we'll be sure to get you on the distribution list as we're putting out e-newsletters and try to keep you up to date, blogs, things like that. And then the next slide, again, I can't say enough that sharing your story is incredibly important. It really matters. One voice really matters. It can make the difference in the success of a piece of public policy because they know if you come forward, there are many others that are having the same situation. Go on to the next slide. So we couldn't get by without talking a little bit about COVID because COVID has just ravaged so many of our lives. And we know people have lost insurance. We know people have lost their jobs. And so we want to be sure to send you in the right direction if you need to get insurance. You can sign up for Medi-Cal anytime during the year. If open enrollment closes at Covered California and you've lost your job, you can still get it. There are different ways of being able to qualify. You've lost your job, you've moved out of state, different things that will allow you to qualify to get into the exchange without paying any kind of penalty. And then let's go to the next one. So continuity of care. So when Joan was talking about the drugs coming off of formulary, there is regulations on the book. We have to keep going back to this all the time. They cannot switch your medicine in the middle of the year. Cannot do it. Unless the doctor says, I want to try something different on you. I don't think this one's working really good. Or I want to try something different. The health plan cannot just say, we're switching your meds. That happened to actually me at the end of the year. And they switched one of my medicines. And I went to my doctor and I said, could you explain to me why you are switching my medicine because I have asthma. They wanted to switch my asthma medicine. Why did they do that? He said, okay, they just automatically did. I said, they cannot automatically do it. Just switch me back. He said, okay, I'll switch you back. So he switched me back. I had to just have that conversation with him. So people don't know that that's all you may need to do is talk to your doctor. And there are rules. These are regulations. And we're constantly having to stay on top of them because they don't, people don't know that they're there waiting for them to help them. Okay, let's go on to the next slide. We just have a few more to go. This is the Choose Smart checklist. So this is when you're looking for a health plan. Here's some questions that you should ask for yourself when you're looking at what plan is going to be the best for you. What are the deductibles? What's the co-insurance? What level? In Covered California, they've got the metal level, silver, bronze, gold. Silver is probably the most common. Bronze is not good for anyone that has a chronic condition. It is a very high deductible plan and it doesn't have the coverage there that you need. So we tell people if you have a chronic condition, look at something else. It might cost a little bit more to get a higher metal plan, but at the end of the day, it's going to cost you less because you'll have more coverage. And next slide. I just wanted to go back and talked about things that have happened. We have a COVID toolkit on our website, on all of our websites. Actually, we have 3 different websites, Chronic Care Policy Alliance, California Chronic Care Coalition, and My Patient Rights. And we have multiple social media platforms that we're also working. Let's go to the next slide. And we can share these slides with you too, so if people want them, we'll pass them out. Here's additional resources that have to do with COVID-19, but I'm also very excited to tell you that coming soon, in the next few weeks, your vaccination guide. We've been working really hard on a consumer guide to all of your vaccinations, not just COVID. And we are partnering with the Healthcare Leadership Council to get this out. And I'm really excited. Joan's been working on really hard. Juliet, our whole team. And so I just wanted to give you kind of a tease that this will be coming up. We're looking for partners and for people that want to disseminate that. And then here's, let's go to the next slide. Now, we have done video stories. This was Vivian's story. She lives up in Reno. Her health plan, she has MS and needs infusion treatments. They were sending her, they had a infusion center of excellence 15 minutes from her house in Reno. But her health plan sends her to Sacramento to get her infusion treatment. So for her to do that, she's got to get in a car, no matter what the weather is, drive down. Someone has to come with her. So we want to tell her story, and her story is up on our website. And there's lots of different patient stories up there of kind of what we do with some of the stories. Some of them will just be information, and interviews, but some of them will be videos. So let's go to the next slide. While we're going forward, because I know we only have a few minutes, if you have a story willing to share, would you please send on into the chat, into the comments, if you'd be willing to share a story. And then let's move to the next one. And this is, again, what we're talking about with your vaccination guide coming up. So to the last slide, I want to thank everybody. I know we don't have a lot of time, but we can open it up for some questions.
Yes, definitely. And if you do have a story to share, please let us know. You can either add it on the comments or send us a private message, and then we will get this information to Liz and her team. It is very important that you know that, your story can make a difference, and your story is important. And we want to be able to amplify your voice and help you in any way that we can. So this is great. I hope that people have questions. So this is a live Q&A. So please put in your questions on there. We will read them and try and answer as many as we can. If we don't get to all the questions today, still type them in. We will go back after the live session and respond to them as we go throughout the day. So we'll just wait because there's a little delay on the comments to see if there's any questions. But I think all this is great. Everything that you guys are doing with the organizations, the bills that you guys are working on that are not just going to be worked on, but it's going to make a difference in our lives. So I really, really enjoyed the whole presentation, the information, and I think a lot of the patients don't realize how important it is for them to be aware and to also know that they have rights. So I'm so glad that you guys were able to share all of this.
Well, and we thank you and sponsors of today, Men with Fibromyalgia, Looms for Lupus, which is amazing, and Support Fibro. We thank you for bringing us on today. Joan, do you have any? Joan is the chair of our board of directors. And do you have anything you want to say?
No, I just wanted to say is that these are fights that we've been fighting for years. I started in 1970 and spent 37 years as the nurse expert for diabetes with the University of Davis Health System and medical school. And at that point, Liz and I, when we think back, some of the things we're still fighting. I came into diabetes at the era where I had to testify and fight to get syringes for patients who needed insulin and get the tax removed. They were taxed very high, like anything that you would buy, not considered as part of the medical treatment. So that's where I started, really at the ground root of diabetes care, and have fought the battle all the way through. So it seems impossible, but it's not. And what we've tried to do with My Patient Rights and with chronic care is to give you the tools to make you the educated consumer, to get simply the care that you deserve. That's what we're all about.
Thank you. And Daniel is asking, what was the first bill number you mentioned? So I don't know if we could bring up the slide again and show just like
that was our bill. Yeah.
Yeah. 752, AB 752. And we'll send letter. I think we've already sent letters of support over to you guys. Feel free to circulate any of that information, the fact sheets, all of that. We are trying to get information, and we're trying to get patient stories.
Yes. And then Karen says, thanks to all of you. This was very informative. I have to log off now, but thank you so much. And we appreciate all the comments and questions on here. This was for you. Here's the bill that we were just talking about, the AB 752. But there's, I think, 3 that she mentioned today that you mentioned, Liz. So these are all, again, very important bills. And if you have a story to share that can help with these bills, that would be great. Please let us know. And I don't know if there's anything else that you want to maybe ask or say, Joan or Liz, before we end the session today.
Well, I just want to remind everyone to continue to share this information. This is such a valuable information for all of us. And we definitely need to, just continue to share. And if anybody has questions, I encourage everyone to continue to ask the questions, and we will definitely answer and get back to you with the answer.
So thank you all again for having us spend time with you. We hope what information we gave you, you'll be able to use. We'd love to hear from you, and watch for our vaccination guide coming out pretty soon, and all of the other great information that comes out every single week. We'll be working with Estella and Juana probably forever. They are sisters of our heart. And thank you for all the great work that you're doing on behalf of consumers.
Thank you, Liz. Thank you, Joanne. And
Thank you.
We just appreciate everything. Again, this is all for everyone. So please let us know how we can continue to help you. Thank you for tuning in today. This was a live session with the amazing Liz Helms, a patient advocate just like you. She started from the ground up, and now she's doing all of this for us, the consumers, the patient community. And yes, you have a voice, so we want you to amplify that voice. And please let us know how we can help you. Share this video with your community, because as you saw, those statistics don't just affect the lupus and autoimmune community or the fibromyalgia community. It affects everyone. And when you talked about, Joan, about the syringes, it brings it back home, because my dad used to get insulin. And those are the things that we need to share and know, that things like raising your voice for this have now made an impact. What you did, Joan, is now helping so many other people that live with diabetes that need to purchase those syringes. So just keep that in mind, how one voice can make such a difference for our future generations. And once you think of that, then know that your voice has power. Imagine what your voice can do to make a difference in the future. Thank you again, everyone. And visit loomsforlupus.org. We will have information and a direct link to My Patients' Rights there, so you can also connect with them directly. Thank you again.
Thank you so much. Have a great day, everyone. Stay safe, stay well, and stay the distance.